So the Dentalpreneur practice model. This model allows the dentist practice owner to spend time focusing on his or her highest value activities and delegate out all other tasks. Clearly defined frameworks and systems provide an enhanced patient experience, increased team effectiveness, and decreased time in the practice. I think that's what we all want. So here's the rise of the Dentalpreneur. We're going to talk about the characteristics of this dental practice model. Okay, this is that completely systematized autopilot practice, completely automated practice that I'm talking about here. Number one, this is very important. You must hire and retain a team based on culture and personality fit first, clinical experience or skill second. Okay? We were talking about this yesterday. You can train a monkey to suck spit and to do a composite filling with you. There will be varying levels of clinical expertise, and some people just don't have it. But for the most part, you can train anybody to be an effective dental assistant, an effective front office person, if you have strong enough systems in place. Okay? Anybody. And if you take somebody off the street that has 12 years experience, has worked with 2 doctors, they know how to do everything in the dental office, and she does not get along with anybody in your office, she will be a toxic cancer and she will cause everybody else to leave. It will not work. You cannot train personality and culture fit. Those are characteristics that people have or they don't. You can train clinical ability. So I want you guys to think about that. If you find the perfect person and they're a great culture fit, they have an awesome personality, they would be unbelievable on the phone, I would take that person over somebody that has a lot of experience and has a crappy personality, for sure, every time. Okay? But I know what you're thinking. You're thinking it's going to take months and it's going to be frustrating to get this nice person trained to be able to do what we need them to do in the practice. But that's not necessarily true if you have the right systems in place. Okay? We'll talk about those today, right now. The practice will strive to provide value to its team and to its patients that exceeds expectations. Now, value is a funny word. When I say value, I'm not talking about cost per crown or the $19.95 special that I do. That's not what I'm talking about. I'm talking about delivering something deeper, a feeling of belonging for your staff, a feeling that they are contributing to something good and worthwhile, that they are helping their own community. We have a billboard in our town in Chino Valley. People recognize our girls all the time, and we have become synonymous with the dental group in town that is, you know, the charitable dental group, and people pull them aside all the time because people recognize them and commend them for doing good things in the community. They feel like they're part of something bigger, and that doesn't necessarily mean that they get their dollar raise every year. It's not about that. It's them about wanting to stay with me and our group because they feel like they belong and they're serving the world in a bigger way. All right, the practice will provide a consistent and predictable positive experience for each patient. So this is another funny thing. Consistency is so important, and I think we miss it depending on who happens to be at the front, who happens to be welcoming you from the reception area to the treatment room. Inconsistency will kill your operation, because if Mary, our all-star, happens to be out sick and Susie, the B player, is on the phone answering all these new patient inquiries, we have a very high likelihood that Mary is going to piss people off and they're just going to turn the page in the yellow pages and call the next dentist. But the best way to do that is, even though you have Mary as the all-star, you get Mary on a specific script, like we're going to talk about, and Susie the same exact script. And if Susie can't perk up and be a little bit more friendly, then Susie goes. And you find somebody else that can sound a little bit more like Mary. Same thing goes with the chairside assistants. We have to plan every interaction. we have a very, very specific way that our chairside assistants go to the reception area and greet the patients. We have a specific way that they walk with them down the hallway. We have a specific way that they seat them in the chair. We have a specific way that they interview them prior to the doctor coming in. We have a specific way that they introduce them to us, the doctor. And having those systems in place creates a predictable patient experience no matter who is working. And you know that even if Mary's gone, that Susie's going to be able to pull it off because she is accountable to this checklist of things that we both agreed on and that she signed and is in her personnel chart. All right, the practice will have the highest standards of organization and cleanliness. Okay, we talk about that a lot. I had a problem with, I was talking to the docs yesterday about this, about my burr setups, and Dr. Reed's burr setups were different, slightly different. And I would be constantly getting his burr block, or he would get my burr block, and it drove me absolutely crazy. So no matter how many times I said it, twice out of the week, they'd be like, oh, sorry, that's Dr. Reed's, and they'd run across the hall to the sterilization room, bring my burr block back. I'm sitting there waiting with my handpiece in my hand to put the burr in the chuck, and it's 45 seconds, but it just, you guys know, it takes all of your momentum away. You're aggravated with that assistant for the rest of the day because it's the fourth time that it happened that week. All right? So a system, strategically thinking, we put a system together so that every single tray setup is identical. We take a picture of it. We take a picture of Dr. Costas' burr block, and on their protocol or accountability for that day, when they walk into that room, yes, check it, physically check it off a list. Yes, Dr. Costas' burr block is here. It's free of bioburden. Yes, we have all of the instruments for the composite restoration on the tray, free of any debris. Check, 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 check. That was strategic thinking, so I don't have to remind them 10 times and still get less than average adequate results. All right, the practice is run in a predetermined, documented, hierarchical structure, which basically means, those are a lot of big words, a lot of syllables. Basically, it means we have an organizational chart, and everybody is aware who they report to. Okay? Before I did this, every single person came to me with every single problem. Mary said this to me. Dr. Nicholas isn't here, but he's funny about how he gives me his accounts about, you know, he's like a referee. He's like a marriage and family counselor. Like every girl comes to him with every problem, and they can never get along, and so-and-so's ganging up on so-and-so. I don't want to hear it. Talk to your supervisor about that. If she can't handle it, talk to the office manager about that. The office manager reports to me. She will give me the briefing after you guys figure it out. But I better not see it reflect in any of your work. You better get all of your accountabilities done. Each team member is held accountable for all responsibilities with a signed agreement. All systems and processes are documented in the practices operations manual.